New cases of the novel coronavirus have been reported in India. One case was from Delhi, the other is from Telangana. Now, what does this mean and should you worry? We are joined today by Professor Ramanan Laxminarayan. Is it even possible to control the transmission of such a disease?
It is possible to control the transmission of such a disease if it's reported extremely early. It's probably likely that there are probably even more cases out there which are just hidden. I mean, it's very unlikely that that you have 80,000 cases or 100,000 cases in China and such few cases in India, which is just next door. So undoubtedly, it's probably somewhere. It's just a question of showing up.
How vulnerable are we to community transmission?
Coronavirus is community transmissible, so it's transmitted by droplets from one person to the other, and you have to be in fairly close proximity. So, and every case generates about 2 to 3 secondary cases, so it is a highly transmissible disease.
There are reports that say that the virus does not attack kids. Is that true?
No, the virus certainly infects children, no question about it. The fatality rate amongst children is extremely low. It's about 0.1%. So it's comparable to a regular flu in children. So that's 1.1% is about 1 in 1,000 children would die. Now that sounds like a lot even there, but it's actually a pretty rare event in that sense. In fact, most fatalities are in older age groups for this particular virus. Now it depends on the virus. The 1918 flu pandemic mostly killed young people. So it just happens to be that this one, it happens to be something that if you're elderly, if you're above the age of 60 and you have other comorbidities, either a heart condition or, if you've been a smoker, if you have respiratory issues, then you have more to worry about and you really should be protecting yourself.
Right. So anybody who's followed the news, they would know of the symptoms. They're largely out there. But what about the asymptomatic cases? And what about the mild symptoms? How can we carefully analyze that?
We really can't. I mean, in a sense, you're talking about something which doesn't even manifest as a fever in many situations. I think all of the things that we should be doing anyway, regardless of whether there's a coronavirus or not, which is washing our hands and making sure we don't touch our face. In any case, we don't shake hands much if you're just, greeting someone from a distance. You do namaste.
We do namaste.
Yeah, that's a really good way to prevent the disease from spreading.
Right.
And I think just those common sense measures are far more important than either worrying about it or thinking that one has to wear a mask. Masks are indicated only for people who actually have the coronavirus or if they're healthcare providers. No one else even needs to wear a mask.
Wow. Now, the other question is, schools have been shut in the US and in China. We know of schools in Noida, which have also been shut. How effective are this?
Well, school closures can be effective for some viruses, especially flu viruses, for which children are major carriers. In this particular case, we don't really know, how it's spreading, and the evidence from China seemed to indicate it was primarily through healthcare facilities. So the school closure is not necessarily the place where we have evidence. I think where we have evidence is that the healthcare facilities, particularly long-term care facilities, nursing homes, these are the places where the virus is spreading. So if you especially happen to be elderly, if you're in a hospital or you have, parents or grandparents in a hospital, those are the people to worry about. Make sure you're using hand sanitizer, that you're exercising good hygiene practices there. I'm not sure that the school closure is necessarily where we'll get the most return.
Professor, could you tell us the status of the vaccine?
Well, we don't have a vaccine right now, and it will probably be reasonably at least about 8 months to a year if we are very lucky to have a vaccine. So I don't think the vaccine is on its way in the next few months for sure.
Now, India is a tropical country. There's some research which says that this virus does not sustain in warmer temperatures. This is how the SARS virus also was eventually contained. So is that something that you also agree with?
We don't know that for this particular coronavirus. In fact, there have been cases reported from Indonesia as of yesterday, and Indonesia is a pretty tropical country. So we don't know. It's possible that with the onset of the summer, usually respiratory pathogens disappear in the summer, and then the stomach bugs come out in the summer. And here it's we don't really know. So we'll have to wait another few weeks to see if that's really the case. And if we are lucky, then it'll go away. And if we're even luckier, it won't come back, later on this year during the winter.
A lot of talk about the precautions as well. There's hand washing, like you mentioned. Then there is also using hand sanitizers and the general precautions. Now, are they effective really?
Yes, hand washing is very effective, and hand sanitizers are effective. Now, a lot of people might be concerned that that the virus may be on surfaces. Actually, coronaviruses don't really survive on surfaces for more than 12 hours or 24 hours, depending on the kind of coronavirus. In fact, hydrogen peroxide is a very good cleanser for coronaviruses. So if you just swab, if you're really worried about a surface, you can get some hydrogen peroxide and you can just swab that specific surface if that's what you're most concerned about. But generally, the combination of hand washing, not touching your face, not touching doorknobs and things like that, which if you can figure out a way in which, and also when you sneeze, to use sort of what's called in the West a vampire cough, that would be helpful. Not enough people actually cover their mouths when they cough. I find lots of people who very happily wear masks in the airport and on airplanes, and when then they cough, they pull down their mask and then they cough and then put their mask back on. Now that is not okay. I don't know, wearing the mask is not particularly useful for you, and coughing into everyone else's face is also not very useful for them, obviously. So I think if we all took care of each other and exercised some sensible, some common sense, I think we'll be fine.
Right. Now, Professor, India has a vast income disparity. Now, there are a lot of people who won't have access to hand sanitizers or masks. We travel in metros and locals. So, in such a situation, it's not possible for everyone to have a hand sanitizer. So, is it really possible to contain the virus if it's in a metro or a local?
I think everyone has access to a little bit of water and some soap, and that's all it takes. So I think even in villages, people have access to soap. So just wash your hands. That's all it really is. You don't need a hand sanitizer. Hand sanitizer for people who can't be bothered to go wash their hands, and that's why they use a hand sanitizer. But right. Soap will do just fine.
Right. Now, since we're in India and since coronavirus has broken here, there's been a lot of talk about, haldi and amla and all these homeopathic cures. We get a lot of these webcoof related queries. Will haldi solve coronavirus?
If it does, I have no idea, and there's been no trial to show this. There is no evidence that homeopathy will cure coronavirus.
Okay. All right. So thank you so much, Professor, for joining us. We will also be bringing you a lot of updates about the coronavirus and giving you detailed analysis on it. Stay tuned to Quint Fit.